My name is Tamara Hazbun. I'm a family physician and obesity medicine physician practicing in Lafayette, Indiana. Thank you so much for allowing me to speak to you today. I'm here to request that a low carbohydrate diet be included as an acceptable diet in the 2020 U.S. Dietary Guidelines. I've been practicing medicine for 21 years. My family medicine practice consisted of wonderful patients, many of whom had metabolic syndrome and obesity. I managed them the way I was trained, with medicines and instructing them to follow a low-fat diet. Unfortunately, over time, many of these patients became sicker, and I found myself chasing their blood sugars and lipids and blood pressures with more and more medicines. In 2013, I began learning about low carbohydrate diets as a way of improving metabolic health. I was skeptical at first, but after reviewing the literature, I gradually integrated low carbohydrate into my practice. My patients started to get healthier. I had such phenomenal success that in 2016, I completely switched the focus of my practice to obesity medicine and metabolic health. In my obesity clinic, I teach my patients how to eat a low carbohydrate, moderate protein, high fat diet. For adults, we start with 50 to 75 grams of carbohydrates per day and then often reduce to 30 grams a day. For kids, we shoot for 60 grams of carbs per day. Initially, when I explain a low carb diet to my patients, they are flabbergasted. They cannot believe that a doctor is telling them to increase their dietary fat because they have been told for their whole lives that in order to be healthy, they must eat low fat. As my patients progress through my program, learning to eat low carb, high fat, I'm often able to remove medications, including those for blood sugar and blood pressure. I also see their lipids improve. I have so many stories of patients who have been successful in my program. Those who've gotten off insulin, patients who've lost 100 pounds, but I'm going to close with a story about a teenager named Chad, because really, we need to change the guidelines so the kids have a healthy future. 16-year-old Chad came to my clinic with a percent body fat of 32, which is considered obese. He was a high school swimmer and worked out 2 hours per day year-round. He was frustrated because he had obesity and pre-diabetes, even though he was an athlete. Over the next 6 months, my team taught him how to reduce his carbs, eat moderate protein, and increase his dietary fat. His blood sugars improved, and so did his weight. We've got to include low carb in the dietary guidelines. It's imperative for the health of our country, and especially the health of our children.
Be sure to hit that subscribe button for more highlights and information about the changing dietary guidelines in 2020, and exclusive analysis you won't find anywhere else on YouTube. And make sure to hit that notification bell too, so you don't miss the next video. Y'all know what time it is. Red Pill Vegan. Next.